I'm sorry, excuse me. Supervisors, can you please self-mute before we begin this meeting and unmute only when you wish to speak? Thank you.
All right, so good morning. I'm going to gavel this meeting to order at 9:06. Okay, could the clerk please do the roll call?
Yes. Supervisor Brown?
Here.
Supervisor McCowan?
Here.
Supervisor Jurdy?
Here.
Supervisor Williams?
Here.
Chair Haschak?
Here.
Thank you.
All right, so I'm going to shift over. You can see the flag. I'm going to lead us in the Pledge of Allegiance. Okay. Ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so has there been any public expression received for items not on the agenda?
All public expression has been attached to the agenda and pushed to the public.
All right, so we're going to agenda item number 4 of the consent calendar. And just to lay it out beforehand, whenever we have a discussion or a vote, I'm going to start and go in order of the supervisorial districts, and I'm going to rotate that each time. So first we'll start with the first district, second time we'll start with the second, and so forth. I hope that's fair to everyone, and hope that you all get your comments in when needed. Okay, so I can see Supervisor Jurdy and I can see Supervisor Williams, but Supervisor McCowan and Supervisor Brown, you'll have to just let me know verbally if you have something that's not in the order.
Mr. Chair, if I may, this is Christian Curtis, Acting County Counsel. Before the chair proceeds with the agenda, I would suggest just addressing, we've got some requests for some off-agenda items to be considered due to the current emergency, and I would just suggest if we could take that part up first, and I believe CEO Angelo can address the substance of the items.
Okay, and that's listed on our agenda as item 8A. So CEO Angelo?
Chair Haschak, there's actually 2 items. One off-agenda item that you're referring to, I believe, is the evictions. We have another one. And given the interest of time of our physicians, we would like to go to that item. On Friday, this past Friday, we did a board meeting. Chief Counsel, please.
I'm sorry, if I may, before we take up the item, I would just suggest if the board could vote on whether to take it up at this time. The board needs a finding that an emergency situation exists. I believe that is satisfied by the current COVID-19 emergency, but we do need a roll call vote determining that the board has made that finding and is elected to take up the item.
So since we have 2 items, we have to vote on each one to take each one up?
Correct.
Right, and so I think that CEO Angelo was explaining what the first one was.
Chair Haschak, the first item is an update with possible, with direction and possible action on our local emergency and our local public health event, specifically COVID-19.
All right, so County Council, are we ready for a vote on that to see if we should take it up?
Yes, and I would just request that the vote be reflecting a finding that an emergency situation exists.
Mr. Chair, I so move.
Second.
I'm sorry, who was the second?
Williams.
Thank you.
All right, and this needs a 4/5 vote?
Actually, Mr. Chair, in the event of an emergency situation, it needs a simple majority.
Okay, very good. So we're voting now to take this into consideration today as an emergency item.
Supervisor
Clerk.
Brown?
Yes.
Supervisor McAllen.
Yes.
Supervisor Haschak.
Yes.
Supervisor Jurdy. Supervisor Jurdy.
Yes.
Supervisor Williams.
Yes.
Thank you. The motion carries.
All right, so are we going to deal with this issue right now then?
Chair Haschak, yes, we would like to do the COVID-19 update at this time.
Okay, very good. Then proceed.
Thank you so much. So we did a special board meeting this past Friday to apprise the board of COVID-19 and the status in Mendocino County. And when we put this agenda together on the same day, at that point in time, we thought that we could cover COVID-19 during the CEO report. Since then, we think that the item is much bigger than that, and so we wanted to go ahead and do an update to the board for direction and any possible action. We've also had many, many questions from board members and also from members of the public. We would like to update you at this time, and our health officer, Dr. Mimi Duen, is with us, and she will speak first. I would also like you to know that we have our deputy health officer in the room as well, and then we have Jen Banks from Coastal Valleys. She is here to answer any questions as well, and we have Lieutenant Shannon Barney, who is our EOC manager, and our Sheriff Matt Kendall. And before we go, just as a recap for this board and for the public, this is a combined event. This is an event that is a local emergency, and this is an event that covers the whole county. All county offices are involved, as evidenced by some of the departments that have either closed or reduced their hours and their non-essential services to the public. We have a combined response between the executive office and the sheriff's office with the Emergency Operations Center and providing all of the logistics. We have a combined response between public health with the public health officer and Sheriff Matt Kendall regarding enforcement. So now is the time to ask your questions regarding public health, regarding COVID-19 response and the status, and also the status of testing, enforcement, and any other activities that you have questions about. So at this point in time, I would like to turn it over to Dr. Duen. Dr. Duen has some emergencies actually that she's dealing with this morning. So I have asked that we attempt as much as possible to stay between 9 a.m. and 10 a.m. for Dr. Duen. So Dr. Duen, if you could please give an update, if you could do that in about 10 minutes or so to allow a good 20 minutes of questions from the board. Thank you. Dr. Duen, are you there? Maybe you're muted.
I'm here.
Thank you. I'll turn it over to you at this time.
Okay, and to share that background noise isn't coming from my phone. I was on mute until just this minute. So thank you, Carmel Angelo. Thank you to the Board of Supervisors and those present in the room. I want to share to start with that as a health officer and keeping close track of what's going on in our region as well as the nation, I did recommend social distancing for our EOC starting, well, we've been moving into this last week, but strictly starting over the weekend. And so Carmel Angelo gave me permission to work from home from a distance. And I've been doing that, I think, quite effectively. Worked 13 hours yesterday from home on back-to-back phone calls and on call at a moment's notice. And that is continuing today. So I am calling you from home, and that's what I'll be doing for the rest of the week. So to start out with saying, you know, what is the role of the health officer in a public health emergency in a pandemic? Well, we have stood up our EOC, and I'm the subject matter expert working to inform and advise our incident commander, Carmel Angelo, and our EOC manager, Shannon Barney, about the COVID-19 pandemic while fulfilling my duties as the health officer. So I report closely and daily to Carmel Angelo. We are in constant contact, and that is in this role that I'm reporting to you today. So everything I'm telling you today has been discussed closely with our leadership team and with Carmel Angelo. I'm very grateful that Carmel appointed Dr. Flaherty as my deputy health officer. This was an essential move that has helped enormously. And I would like, when I'm done speaking for Dr. Flaherty, to say a few words to introduce himself to you. I'm sure that for all of you watching the news and seeing this horrible tragedy, this pandemic unfold across our planet, you may have questions about what I'm doing as your health officer. You may hear that I'm working 16-hour days, but much of the work that we do may be invisible to you. So I just want to quickly run through a list of some of the things that I've been doing in these long days. And I have not taken a break for many weeks, and I will take a break when it's the right time, but it is not the right time now. So I want you all to know that I am fully committed to Mendocino County. I'm committed to this role as health officer, and I will continue to serve as I am without break as long as I need to make sure that we get through this together. So you have my commitment and my promise. So in terms of accomplishments, I'm just going to quickly run through a list. This is not comprehensive, but it's going to touch on some of the things that are involved in my everyday. For one thing, I monitor the situation closely and have been since the very first week of January. On Super Bowl Sunday weekend, I have told some of you this before, but I was meant to go on a vacation out of town to Trinidad to the beach, and was advised to stay in Mendocino County because the situation was really starting to rapidly evolve over that weekend. And I have been on this, case intensely since Super Bowl Sunday weekend. The way that I monitor the situation is that I'm part of the Association of Bay Area Health Officers. So anytime you see anything announced about what's happening in the Bay Area, what's happening in Sonoma, what's happening in Marin, I've known about it for days, for weeks. So I am intimately involved in that process of decision-making that is carried out by the Association of Bay Area Health Officers. We're very fortunate that really in the nation, the Association of Bay Area Health Officers is setting an example of regionalization of response, which is why there is some data coming out of the Bay Area now showing the curve possibly starting to flatten because of the regional shelter-in-place orders that have been instituted. And as you know, the shelter-in-place orders that we instituted, the first ones followed, I think it was only 1 or 2 days. It was certainly within, minimum number of days from when the Bay Area Health Officer shelter-in-place orders dropped. So we have been closely modeling our orders after the Bay Area, and every time they make a move, we're making a move within 1 or 2 days, right behind them, as quickly as we can, because of course, it takes time to write a shelter-in-place order that's right for our community. So I'm in close contact on a daily basis with the Association of Bay Area Health Officers. I also am part of a coalition of the rural health officers to our north, from Lake County all the way up to Humboldt. And we have regular meetings and are in regular communication so that we are also in alignment. I'm also closely tracking the CDC at the federal level and the California Department of Public Health communications. So I have put out with our team, with our leadership team, multiple communications, advisories, recommendations, and orders, in step with our regional response that is initiated from the Bay Area. Also, we have been working to organize volunteer doctors, and I have multiple calls every day with doctors from our community, whether they're volunteering for us or whether they're working in the emergency department, in the clinics, directors of our community clinics. Also regular conversations with our Coastal Valley EMS. We have a 7 a.m. call every day. We have a call at 9:30 with our healthcare partners, with our SNFs, with our jail. We have responded when there have been concerns about cases every time. We're responding, we're calling, we're doing contact investigations. The case that you know about from the South Coast, we are in daily, multiple times a day contact regarding what is going on with that case, what is going on with the clinic that is connected to that case. That is being done by our public health team and our EOC. We have been tracking returning travelers, including those from cruise ships, closely with their at-home quarantine, and reminding you all that quarantine is for people who are not sick, but that have maybe had an exposure to somebody who has the disease. Isolation is for cases or people that were in the process of testing who we expect have COVID-19 because the test is pending, or we know have COVID-19. That's what isolation is for. Quarantine and isolation are different. Quarantine for asymptomatic people. So we've been tracking returning travelers who are, and cruise ship passengers who are returning on quarantine. None of those individuals that we have monitored their quarantine have become sick. None of them have been tested. We are working on alternate care sites where we could have surge capacity. And this is a complex effort because there's different populations that might need isolation. Some of those populations will perhaps be homeless and have multiple issues such as mental health issues, substance use issues that need to be wrapped into that isolation facility. Others will be frail elderly people, perhaps from a skilled nursing facility that doesn't have the isolation capacity in that facility. Others might be people who are end of life or who are do not intubate, do not resuscitate individuals that would not want to be intubated but need to be isolated in an environment that is going to provide them comfort at end of life. We have a lot of different categories of individuals we need to think about providing isolation for, and we are working on that on many fronts. And I will leave it to, in a moment, I'll defer to Carmel Angelo about whether she wants to talk about any of those specifically. Testing, as you know, is a national issue. I think we have done an incredible job here in Mendocino County advocating for the ability of public health to support our healthcare partners in testing. I will tell you that as I talk to other health officers around the region, we are a standout in terms of the work we've been doing in public health to help our hospital and our clinics to get high value tests done through public health. When the commercial labs are taking 7 to 10 days, we're able to get results turning around in 48 hours. And that is, Dr. Flaherty has been leading that, and we can share data about that. But we have done, this is from yesterday, I'm talking off the top of the head, I'm not seeing this in front of me, the data, but it was about 100 tests yesterday that we know have been done in the county, and only about half of those have been resulted. And that's because of a slowdown on the commercial testing at Quest, which I can speak to if you want information about that. Regarding the public health lab testing, I believe as of yesterday, the number was about 15. These are tests that we courier over to the Santa Rosa lab, and we do in coordination with our healthcare partners who might say, we have a very high profile person in our hospital, we want to make sure we get this result back quickly. We've had individuals like workers from the jail, we've been able to return back to work because all of the tests we've done through public health have ended up negative at this time. We get those results back faster, as I said, because it's our own lab in Sonoma. The other thing is about social distancing. This is, as your health officer, this is an area that I can really use my voice and my position in our community to lift up this message. We also have our PIO team working very hard on this, and through our health officer orders with our county council, with Carmel Angelo, we have been focusing on this as a top priority. As I presented to you before, we have containment on one hand as our approach to a pandemic, and then we have mitigation. On the mitigation side, we would want to have a vaccine or a treatment, which we don't have. Then the next tool is social distancing, sheltering in place, closing schools. This is what we can focus on. We never closed the schools. We put them into modified schooling. But this is an area we are focusing on with great intensity now, this social distancing. You will see that last night I released a press release with our PIO team. A quote from me is there, a quote from Jim Flaherty is there. And that press release, we hope, is giving the message to the community that this is a very, very serious situation and that is warranting stricter sheltering in place orders, which are coming out today. I am working in close coordination with our Association of Bay Area Health Officers, as well as our health officer in Sonoma and our health officers to the north with this shelter in place order. I know that there are those of you that are aware that the Sonoma health officer put out orders for closing the parks, as did the Lake health officer. I knew that days ago. This is information that I have, and we have been crafting our own orders to come out it was the weekend, right? We are working as hard as we can to get it out yesterday, but we felt that we really needed another day to make sure we got input from our supervisors. And so that sheltering in place new restrictive order is coming out today. And you will see in it elements that are going to address the concerns that we've been hearing from our law enforcement who need to enforce the shelter in place orders, from members of the community who say they go to the shopping store and they don't feel that there's sufficient social distancing occurring in the grocery store, which is a clear essential business, and also to provide clarity to those businesses that are operating about what is essential and what is not considered an essential business. My message is going to be that we need to focus on those essential businesses that are required for us to live, like a grocery store, and focus on enforcing social distances in those places where we can clearly see there are violations happening. There are a lot of details about what might be happening behind closed doors that we don't see. We need to focus on what we can see, because we need, at this time, I'm talking about today, now, this, in the next coming days, we need to make our public comfortable with getting food. We need to make them comfortable that they can do those essential functions that they require to live. And that's one of the clear roles of the health officer. So I know this is a very difficult situation for every single one of us. In a pandemic, there's nobody who's safe. The Marin health officer, Matt Willis, who I've been working with closely, as well as the other health officers, has announced he had COVID-19. This was something that I was aware of. All of the health officers are tracking closely how he's doing. He's doing well. He's isolated at home. So please know that I carry this responsibility as your health officer with the deepest level of commitment possible. I'm here for you and our community. I will continue to be of service, and I thank you for this opportunity to present. I will take a pause there and turn to Carmel Angelo to ask if there are any questions I should address at this time.
Thank you. Thank you, Dr. Duhan. I think that a couple things that I'm sure the board has questions, so I would like to go to the board, but before we do that, I would also like to remind the board that we have Dr. Jim Flaherty, who is our Deputy Health Officer, in the room, if there are questions for him, along with our EMS Coordinator, Jen Banks, is here, if there are questions for her. And we have Shannon Barney, our EOC Manager, if there are questions regarding daily operation, and we have Sheriff Matt Kendall here, if there are questions about enforcement. So, Mimi, I am going to open it up for the board members. Actually, Chair Hashek, I'm going to turn it back over to you, but I just want to be certain that we do touch on testing, the shelter-in-place order, enforcement, and equipment needs. So at this point, I would like to turn it back over to you, Chair Hashek, for questions from the board for either Dr. Duhan or anybody else on the team. Thank you.
Okay, thank you very much. Dr. Duhan, I have a question about the number of cases. You know, we're stuck at this one case that's been noted, and I've heard from people that, you know, because there's only one case, that people aren't that worried, that they're not taking the shelter in place seriously. And so is there a way that we could look at the suspected cases or broadcast information that shows that this is much more serious than this one case?
Well, can you hear me?
Yes.
Okay, thank you for that question. As you know, let me give you a little bit of background information about what's going on with commercial testing at Quest. So for the entire nation, there's one commercial lab company that's up and running right now, and that's located in San Juan Capistrano for the nation. It's called Quest. That lab, samples need to be sent to that lab to be tested, processed. And they get, as of yesterday, it was about 16,000 samples a day, and they can process 3,000. So those results that are coming into Quest from around the country are backed up by 7 to 10 days. So the Public Health Department has stepped in to help with this by taking high-profile potential cases, you know, that have test results, or excuse me, that have samples that have been collected by our partners, our hospitals and clinics, and couriering them to the Santa Rosa lab and getting those results turned around quickly. But this is one small public health lab, relatively small public health lab. They also have a limitation of how many samples they can run in a day. So we are limiting who we are testing to, because of this limited capacity, we are limiting who we are testing through the public health department to certain criteria. Now, clinics and hospitals, they can send tests to whoever they want to. We're not limiting that. But if they're asking for our participation, we are limiting it to individuals that are of high public health priority, such as healthcare workers, first responders, law enforcement, individuals working in the jail, people that like our EOC, our leadership that we need to keep operating, as well as in the hospital, any cases that or individuals that come in where the management of this individual would be changed by knowing the result of the COVID-19 test. So we must do that at this time. We must limit the amount of testing being done because of our limited testing capacity. We are, with the shelter-in-place order, protecting the community by making sure that anybody who might have mild symptoms or be in the asymptomatic phase are not spreading the disease in our community. If there are people in our community who do not think this is a serious problem, I think it's only going to be a matter of a week before their eyes are opened as the Bay Area has this exponential growth starts hitting regions closer to us. My son lives in Seattle. I'm in close contact with my son. He's 27, and he believes that today Seattle is going to be quarantined so that no one's going to be able to leave or come in Seattle. Anyone who sees the pictures of New York City are going to cry and weep. We have no protection around us that is a great enough wall to keep this disease out. I believe it's here in our county. When you understand exponential growth, 1 goes to 2, goes to 4, goes to 8, goes to 16. We haven't hit the exponential growth phase where we would see it impacting our hospitals in a big way. But if we don't take these serious efforts of sheltering in place and social distancing, we will see it. So I don't know what to do to change people's minds whose eyes are closed, but our stronger orders, my press release yesterday, which was supported by Jim Flaherty's quote, hopefully will wake up more people. And I will continue to be the voice that says, this is serious. It's so serious that we are limiting the freedom of individuals to participate in their daily activities, and businesses are being limited. I would never do this if I didn't think it was absolutely necessary for the survival of our healthcare system in our county.
Well, thank you very much for that. And I guess the follow-up question would be to Sheriff Kendall, is that I think that the board would be very supportive of enforcing this. And when we find that there are cases that aren't being, or people who aren't respecting the orders, then we would like to know whatever we can do to support you in your role as the chief enforcement officer of the public health order. So. Sheriff Kendall.
All right, I'm sorry I was moving and I caught about 2/3 of what you said, but I can discuss enforcement with you.
Well, I'm just saying that I think that we need to take this very seriously and make sure that the public takes it seriously. And the board is very supportive of your efforts to enforce this shelter-in-place order.
Thank you. We are taking it seriously. We began forming some small task forces, and we've moved through the county over the past 2 days. Estimates are that we've contacted roughly about 100 hotels, made sure that we were getting compliance. I've been on the phone with the chiefs of police of all the cities. They're going to be working with us to make sure that we can continue to keep the enforcement in place with education, and a little bit of stern talking to has had to happen.
Very good. Thank you. And know that we're supportive of your efforts.
Thank you. I appreciate that.
Okay, so we'll move on to Supervisor Brown.
No other comments or questions.
Okay, Supervisor McCowan.
Good morning. I've got a series of questions about the public health officer order. We can come back to those if you wish. I would say that, and I didn't see the press release, I don't see that it was sent to me. I hope it laid out the numbers of here's what we're actually trying to avoid with shelter in place. I think there's an unreality to this pandemic in that everything seems normal except for the closure order, of course, but people aren't getting sick, people aren't overloading the hospitals, we're not scrambling to find enough ventilators and oxygen and other life-saving equipment. I don't think people realize, many do, but many don't. That could all change very quickly. And we have very limited capacity in our hospitals to deal with a surge of people who become ill. We see everywhere else in the world, things go along at a relatively low level, and suddenly there's a sharp spike. If we hit that sharp spike, our healthcare facilities will be overwhelmed probably within 2 weeks. That's what we fear, that's what we're trying to avoid. I just don't think people are understanding how serious this is. I understand conservative projections are if the shelter in place doesn't flatten the curve, and we hope it will. If it doesn't, we could see 30 or 40,000 people become ill in Mendocino County. We could see over 3,000 needing hospitalization. We could see approximately 1,800 needing to be in an intensive care unit. So I'd like the public health officer to maybe comment on the gravity of this situation, and am I stating the potential correctly, or what more can you add or correct to that?
Can you hear me?
Yes.
Okay. I'm muting when I'm not talking, so I'm unmuted now. Thank you. Supervisor McCowan, you expressed that actually very clearly. I think everything you said was correct. Let me talk about the numbers. One of the frustrations that we have, the health officers have, is that when Newsom gave his speech last week where he talked about sheltering in place, and these orders that were coming from the state of California have a lot of gray area. It's hard for us to know exactly what Newsom's orders meant. And we're working to clarify what is black and white in his orders. But he was using data to guide his decision-making that the health officers have not been able to see. We've been asking for that data from the state, and we have not received it. So that data is coming out of statewide, all of the positive tests that have been done. Now, we also have negative tests that have been done, and that's part of the calculation. The issue with the data, however, we all know, is that because we've had limited testing capability, it's not great epidemiologic data, because you would want to test more people to have very reliable data. But what we've done amongst the Bay Area health officers is we have come up with modeling scenarios that we believe are driving what Governor Newsom, with the information he has. So there's different modeling scenarios that we can use that are mathematical, that are coming out of the academic institutions. So the scenario that the health officers have been looking at, which is considered a moderate scenario, is that 40% of people in a population, let's say in a county, would become infected in the next 12 months. So if you look at 90,000 people and 45% of those people becoming infected in the next 12 months, that would be about 36,000 people infected. The data that we have, the health officers, is that about 10% of the people require hospitalization. This is over a time period of 12 months. So we would say that about 3,600 people would need hospitalization. And of those that are hospitalized, our data suggests that about half of them would need intensive care, ICU care, which is 1,800 people over 12 months. Now, if 1,800 people over 12 months need ICU care in our county, it will overwhelm our system. If sheltering in place isn't enforced and those cases come faster all at once, If we had 1,800 cases needing ICU care in our county in the next 3 months, there'd be nowhere we could provide that. Now, some people are asking whether we should have more ventilators, but we need doctors to man and woman those ventilators. So even if we had 1,800 ventilators, we wouldn't have the medical staff to function, to work them, to operate them. This is why our greatest tool, our greatest weapon against this pandemic is sheltering in place, social distancing, and that's why you're going to see these stronger sheltering in place orders coming from me today, which include closing the parks. We were already planning this weekend, closing the parks, closing the public places so that we can have more enforcement capability. I want to also share with you that due to the expanded testing that we're doing, and due to the close communication that we have with our clinics, I can report to you that this morning, as of 7 a.m., there was a second case reported to me as the health officer. This case is not been reported to the press yet. I just received it this morning at 7 a.m. It's in the inland area. The individual is on isolation, is not a risk to the public, is not a healthcare worker, is not somebody who would have exposed the public given the nature of their daily activities. So it's someone who's everything was done properly by the clinic and as well as by the individual to protect the public. But this is somebody who was exposed outside of our area. So it was from a direct COVID-19 exposure. And more information will be coming out later today on that. That's it for my report.
All right. We're going to move on to Supervisor Jurdy.
Thank you. Dr. Duhan, if people are not allowed to go to parks, but we do want people to get some exercise, what would you suggest? I mean, it seems to me it's probably pretty safe given how few cars and how few people are out on the streets and sidewalks that people could practice social distancing and yet still walk for exercise on streets and sidewalks and country roads.
This Dr. Duhan, can you hear me? Just to get validation, you can hear.
Yes.
Okay. So there's nothing that would restrict a person from going walking distance or biking distance from their home. We are wanting to discourage people from getting in their cars and driving somewhere else and getting recreation. We're wanting to encourage people to shelter in place. And if individuals are walking with proper social distancing or biking with proper social distancing, then this would be a safe activity. Staying 6 feet apart and not staying in groups. I mean, of course, we understand that a mother or parent walking their child is going to not social distance from their own child. But we are wanting to encourage activities that initiate from the person's home, walking or biking distance from their home. What people do on their own property is something that we're not seeing out in the public. We would assume that they would practice social distancing from people outside their family. Close family is not going to be able to social distance within their own household. We know that households will be in close proximity to one another. We would ask that if anyone was a case or was being tested in a household, that they would isolate away from the rest of their family in that household. We do know in China that much of the spread of the disease was within households. So close household contacts need to be careful if one person gets sick for that person to stay away from the other members of the household. And our shelter in place order includes that people who are sick need to stay home. And people that are at high risk of serious consequences from the infection should stay home.
Okay. Supervisor Williams.
I have a comment and I have a three-part question. The comment is the social distancing, I think, has had mixed success so far. And part of that is the order has been difficult for many businesses, many residents to fully grasp. I'm hopeful that review by the sheriff will happen this time. And I certainly don't need to see it, but I know Supervisor McCowan has tried for days to give input. And I fully support the public health officer deciding what to do. The how to message it, I think, could benefit from a little bit of review, and I would defer to Supervisor McCowan. The question, how many critical COVID patients can the county care for today with the equipment and personnel we have? How many hospitalizations do we anticipate over the next 12 weeks? And if the pattern we see elsewhere unfolds here, how many deaths are expected? And I ask these questions to help frame so that the public can understand the seriousness. And so I think we have a duty to just lay it out as we see it, the most likely scenario.
This is Dr. Dewan. I would like to hear Carmel Angelo's comment about who should answer that question. I gave data as I opened up regarding, and I do want to go back to the comments, but hold off on the comments about the lack of clarity, communication with the sheriff, and the gray areas in the order, but to just go to the numbers of people who would die and so on. I did give you data about what we would expect based on the current modeling. Regarding the hospital capacity, Carmel, do you have a recommendation about who would respond to that question?
Dr. Dewan, I think you could respond to the questions, and then we have Jen Banks in the room who also may want to add to that, particularly around the equipment and what she's ordered. And I don't know if your Deputy Health Officer, Dr. Flaherty, has anything to add. But Dr. Dewan, if you could please start, and then I'm sure they can add to what you have to say.
Okay, so regarding the gray areas in the order, the initial order, the first one, this second one is coming out today. We closely modeled our order over the coordinated Bay Area, Association of Bay Area Health Officer order. So that was worked on actually in secrecy by the big six counties, because when they released it, they wanted it to be released all at once with a big impact. That order is what we closely modeled our order after, and we added a few elements that we thought were appropriate for the rural community, such as addressing agriculture, such as the fact we don't have big malls, that we have little businesses that we might be able to have curbside pickup. We also did address in our first order the issue of transient occupancy of hotels. I would agree that the order was not enforceable to the extent that we would hope it would be, and it was also not followed to the extent that we would hope it would be. The Bay Area health officers are aware of that themselves and are working together to look at how we might have more effective shelter-in-place orders. We developed our orders in close communication with sheriffs, and we also are listening to all of the feedback that we get through our call center and through what our incident commander, Carmel Angelo, and our EOC manager, Shannon Barney, communicate to me. And these orders that have been the first ones, and now these second ones that I've worked on with our county council, we've also tried to anticipate where the gray areas would be and how we can provide clarity with the language. So we understand the limitations of the first order. We have worked diligently to make these second orders more enforceable and have more clarity. And I will say that they do include closing parks and public recreation areas, which we saw over the weekend was rather disastrous, what happened on the West Coast regarding a lack of social distancing in these areas. I am in daily contact with the emergency medicine doctors from the hospital. Dr. Suzanne Hiramatsu is the director of the emergency department at Ukiah Valley Hospital. I can tell you that they are very, very concerned about what happens if we don't flatten the curve, if we don't prevent that exponential rise in our community of cases. And that's why sheltering in place right now, we are pushing on that as fast and as hard as we can. And we wish that the governor's order had more clarity, and hopefully a new order will come from the governor. I think that's all I have to say about this. I would pass it on to the other speakers, and I'll go on mute now.
And could the other supervisors go on mute when you're not talking?
Do you need me to re-ask the questions about numbers?
Chair Haschak, I'm thinking that Dr. Doohan is ready for Jen Banks and Dr. Flaherty and Sheriff Kendall to comment on Supervisor Williams' questions, if that is okay with you.
Yeah, that would be great. Just if all the supervisors could mute, that would help.
Lindsay, do you want to repeat that to them? Jen, do you want to come up first? And then Dr. Flaherty and Sheriff Kendall? You're in a good spot. You're 8 feet away. Thank you.
Supervisors, if you would please mute your microphones when you're not speaking. Thank you so much.
Good morning. Thank you. My name is Jen Banks. I'm the Emergency Medical Services Coordinator for Mendocino County. And during large-scale disaster or medical health events, I serve as the MOAC, which is the Medical Health Operational Area Coordinator. Before we get started on questions, I just wanted to educate the board and educate the public on what the role of the MOAC branch is during large-scale events. We work very closely on a regular basis with our healthcare coalition within Mendocino County. Our goal is to provide support for all of our healthcare facilities and our public safety agencies. With that, we also serve as the liaison between the state for resource requesting. Our primary effort every day when we come in is to support our healthcare facilities and our public safety divisions to keep them open and to keep them capable to serve the public through the entire duration of the event. I've been working very closely with our Region 2 partners and to define that we have our local county structure and then we are connected to what we call our Region 2 partners, and it's 16 counties that come together and support each other during large-scale disasters and events. Obviously, this event is quite large, so we are submitting all resources through the Region 2 effort, and then they are getting passed forward to the state. Mendocino County is receiving resource request support from the state. Every resource request that I have submitted, we have received supplies. So as of today, I am happy to report that we have been able to fill every resource request that we have received from our healthcare partners. Some have come in with some very high numbers. We do a little bit of back education with them, kind of targeting down PPE use at the facilities so we can really have enough equipment to be able to continue to provide resources to get through the duration of this event, and we know it will be long. So our second order from the state is actually due to arrive this afternoon, and that's really great news that we continue to get what we're asking for. So I'm happy to answer any questions.
Yeah, Jen, are you able to answer questions about how many COVID patients, critical COVID patients, can the county care for today? How many hospitalizations do we anticipate over the next 12 weeks? And if the pattern we've seen elsewhere unfolds here, how many deaths are predicted?
Thank you for the question, Supervisor Williams. At this time, I did not come with that specific data today. We do have some epidemiology capabilities where we can start doing some of the data to support answering those questions, but I don't have that information in front of me.
So I'm going to maybe defer to the CEO, who with us today does have those numbers. And perhaps another way to ask is 45 critical patients approximately the number we believe we can care for? And if the pattern continues to unfold, might we see 1,800 patients?
Chair Haschak, if I could jump in per Supervisor Williams' request, I would say, I'm going to say that Dr. Doohan has really been studying this along with Dr. Flaherty, and I would ask Dr. Doohan to give you her best estimate on these numbers. I think Jen has been exemplary in supporting us. Dr. Doohan?
Yes. Can you hear me?
Yes.
Okay. My best estimate from talking to the hospitals and talking to the emergency physicians is we have the capacity for 45 people to be in ICU beds on ventilators. So if you look at that number that I said, that we would have 1,800 people needing ICU care in 12 months, that's the moderate scenario. That's where we have some slowing down of the curve. And there's another piece of information here that's very sobering, that those people, the people that get very sick with COVID-19 have what's called ARDS, so it's acute respiratory distress syndrome. And this is a condition where the lungs become stiff and it takes a long time to get better. So we're seeing people being on ventilators for 8 weeks. So you can imagine that if you have 45 vents taken up by people who are going to be on them for 8 weeks, we do not have the capacity to respond to 1,800 people needing ICU care in our community. So the question of how many people would die, estimate would be 1,800 people based on how many can get ICU care. Sheltering in place can work. Everything that we're doing can work to turn this curve around, especially because we're doing it coordinated with our region, which has nationally been remarkable, that we've been able to coordinate our entire region. And in that region includes all the way up to Humboldt, because the health officers are now having a rural working group where we're coordinating with the Bay Area. So we can create a firewall with sheltering in place, but it will only work if that sheltering in place truly happens and social distancing truly happens. We have to protect our healthcare workers. This is an absolute priority, and that's what sheltering in place also does, because they're getting less exposures. I will say I'm very pleased that the 2 cases that we have in our county, in both of those cases, the healthcare workers and the clinics participated in the care of the patient impeccably. They wore their PPE, and they did not have exposures because of that. So we are doing a good job also messaging and coordinating with our healthcare partners and with Coastal Valley EMS through the MOOC function with Jen Banks, making sure our people have PPE. And they do. They are being provided by, we hear horror stories around the country, but we do have the appropriate PPE for the people that are caring for patients in our community. I don't know if that's, was there another question, Supervisor Williams, that I did not answer?
No, I think that answers it. And the thrust of the question is, I think as we put press releases out, if we can include a realistic expectation, if we follow the health officer's orders, what we expect to happen, hopefully we don't see a surge, we're successful. If we don't follow those and there isn't a plan B, I think it's worthwhile to say that so the public understands the critical nature. We don't have a second chance if we're unsuccessful.
The other side of that equation is that we need to expect this to have an extended duration, because if we shelter in place until April 7th and then we come out and stop sheltering in place, it's not going to be effective. We have to wait. This is going to take months. And this is something that's very hard to accept. That's why our new health officer orders about sheltering in place we're working on them not having an end date. The governor's shelter in place orders did not have an end date. So the original ones had April 7th. I hear that feedback about the messaging. Our message from the press release yesterday, I talked about the healthcare systems around us on teetering on collapse, and that was strong language. I will take into consultation with Carmelangelo and our PIOs whether we want to actually talk numbers in our next press release. I think it's a very important point, and again, it's modeling. We don't know. We're using the best models that we have. If the governor would release the data that he used for his decisions, that would help us. And that's one of the things the health officers are strongly advocating for, is to get the data. That's it for my comments.
Thank you. I have no further questions, but you've instilled a lot of confidence, and I appreciate your hard work.
Thank you, sir.
Well, thank you, Dr. Duhan, and certainly the whole team that you have there working on this. We totally appreciate it. We're very supportive. Whatever we can do to support you, we want to know. And certainly that goes to the CEO, Carmelangelo, and her team, and the sheriff, and the emergency services. So all of you, whatever we can do to help, let us know. Thank you. And I'll turn this back to CEO Angelo.
Thank you, Chair Haschak. I think at this time I would like to give Shannon Barney, our EOC manager, an opportunity to update the board. And then also, following Shannon, the important thing is that you all know who the team is. I know you do. I don't think the public does. So it's important to give an update and also for the public to know the team. So I'll go to Lieutenant Barney, please.
So good morning, Shannon Barney, Lieutenant with the Sheriff's Office, EOC Manager. I appreciate the opportunity to kind of catch you up to speed on what we're doing in the EOC. As Dr. Doohan earlier stated, she's directed us, rightfully so, to establish some social distancing within our Emergency Operations Center, which in and of itself is a difficult decision because we have a relatively green team. They're doing very well. And so we're just having to adjust how we keep in contact. There will be little delays in communication, but we're working through those bugs fairly rapidly. I have to commend the county IS team. They have been working nonstop to support us in our movement throughout the county. We started our move probably on Friday and then carried through Saturday and Sunday, and we should be complete by the end of business today. And, similar to what this meeting is right here, we're going to be just distance communicating a little more and trying to work the bugs out of our communication system so nothing falls through the cracks. On a side note, we have, as Sheriff Kendall earlier stated, initiated a task force to be out in the community. There are calls from the community coming in to the call center on complaints of or suspected businesses that are not compliant. I do have an update on some of the Board of Supervisors' concerns about wine tasting facilities and such. The crew went through the entire Anderson Valley area yesterday, and they contacted about 15 they responded to 15 businesses, and all of those businesses were closed, and that includes brewery tasting rooms and wine tasting facilities. They are going to expand that out. I think we have them scheduled to keep going and to also be able to respond to complaints. We have basically 4 sectors designed in our sheriff's office, and we're going to have a team in every sector for the next few days to handle any of those complaints that come in. So far, the call center has been working efficiently and fluently. We're anticipating if this ramps up a little bit, we may end up having to man the call center 24 hours if needed. We have a plan with HR and the call center manager to be able to do that, and we can expand our capabilities out in that fashion to handle those calls coming in. There were some early issues about clearances on our calls. That's been rectified. And right now, I think our team is doing as well as can be expected. There are, as I said earlier, some communication issues that are presented by our current situation, but those are just going to have to be worked through because the greater good is to hopefully not have more of our team going down by being exposed to each other if somebody gets sick within our group. We prioritized our senior leadership as having worked from home. Dr. Doohan's working from home. Carmel took a day from working from home just to see how those are working out. We kept in good contact, so it seemed to be working well. So that's kind of where we're at. If you guys have any questions, I'll be happy to take them.
For Lieutenant Barney?
Go ahead. All I heard was Lieutenant Barney.
Oh, I was asking Supervisor McCowan if he had any questions or comments.
No.
Okay, thank you. Supervisor Jurdy?
No.
Supervisor Williams?
No.
Supervisor Brown?
No.
Okay.
Thank you.
Thank you, Lieutenant Barney, very much for your efforts.
Chair Haschak, our Deputy Health Officer, Dr. Flaherty, would like to give a report as well.
Very good. Okay. Welcome, Dr. Flaherty.
Thank you, Supervisor Haschak. I don't know all of you. I know John, both Johns. I'm Dr. Flaherty. I'm new to the team. I'm a retired pediatrician and emergency physician. I was an EMS medical director and familiar with emergency operations centers and the function of incident command. What I wanted to just briefly tell you about and try to put in perspective is the relationship between surge capacity, staffing, and ventilators. There can tend to be a focus on ventilators, and there's a bigger issue. If we got delivered 100 ventilators today, we couldn't use them. I'll tell you why. So in her initial presentation, Dr. Duhan said that if we have a big surge capacity, and also let me put this in perspective, we've never dealt with the surge capacity like we need for this. H1N1 pales in comparison, okay? So, but if we have a surge of patients that we need to take care of, the hospitals need more beds, they need more doctors, they need more RNs, as Dr. Duhan said. But we can have all the ventilators in the world, but if we don't have the licensed respiratory therapists, referred to as RTs, to run those ventilators, we can't run them. Doctors can't run them, nurses can't run them, it's not in their scope of practice, it's highly technical. And RTs usually manage several patients on ventilators in a shift. A nurse can respond to initial alarms, but they page the RT if they're not already there. So our surge capacity is limited by staffing, not by equipment. That's the take-home message. The only thing I can think of in terms of increasing the number of RTs, and there's a limited number of licensed RTs in our state, is just like New York has done with medical students and RNs and pushed them out into the workforce and certified them. Perhaps the state could say we could push out the RTs that are in training early. Thank you for your time.
Chair Haschak, if we could give Sheriff Kendall an opportunity to also speak to the board at this point in time, that would be great.
Certainly. Welcome, Sheriff Kendall.
Thank you. So I'm not sure, do you want me speaking about the next issue with the, okay.
I have a question.
The only further thing that I have to say on that, go ahead with the question first.
Sorry, if we're moving on, I had a question. Is that all right, Chair?
Well, hold on, Supervisor Williams. Okay, Sheriff Kendall.
So basically, one of the things that we're looking at the Sheriff's Office, we're working right now with Special Investigations Unit. We formed those small task forces. We're getting some compliance, or getting, I should say, good compliance in most areas. And we also need to reach out to our public and say thank you to those that have been complying from the get-go. As we move forward on this and the new orders get put into place, the Sheriff's Office is going to be taking those and running with them. We're going to make sure that that we're carrying the message and getting it out there, along with the education. Is also going to have to come the enforcement. Thank you.
All right, I'm going to go in order, starting with Supervisor Jurdy. Do you have any questions?
No.
Okay, Supervisor Williams.
Yeah, I have a question about the ventilators, and I know the public shares this concern. I've heard from a great number of constituents. Are we currently at the maximum equipment based on the personnel we have, or is there some room to augment? And I'll give the coast as an example. I understand they have 4 ventilators today. I asked how many more could they operate, and I was told between 6 and 10. Is that accurate, or do we feel that we don't have the personnel, even if we had the additional machinery?
Dr. Flaherty, are you still on?
Do you want me to? Thank you for the question, Supervisor Williams. This is Jen Banks, and I will try to address your question, and Dr. Flaherty can then provide follow-up. We have we issued a survey to all of our healthcare facilities late Sunday afternoon to assess our surge capacity in regards to ventilators in Mendocino County. At this time, our 3 hospitals have responded to the survey. And just to put some preliminary numbers out there and what their surge capacity description looks like, so you have an understanding of some of the work that's being done to address this concern. Mendocino Coast District Hospital has 14 ventilators per their survey response. And they also have the capability to use BiPAP. For those that don't know, BiPAP is also a machine that provides ventilatory support to patients who are having respiratory distress issues. So in their surge capacity description, they've responded to the county that they have 3 respiratory therapists. They're looking to hire a 4th. They are looking to contract FTEs who can provide surge support to that facility. Nursing can also potentially monitor, and they are actively working on a tent going up that could be used as a ward to cohort COVID patients. So there's a lot of planning going on like this with each individual hospital in the county. I do stay very closely connected with Dr. Duhan and Dr. Flaherty. We have a call with our hospitals almost every day, but a very specific call that happens 9 a.m. on Mondays, Wednesdays, and Fridays with the CNOs of our hospital facilities. Those CNOs are Lynn Finley, Linda Givens, and Lindsay Spencer, and it's our time to really discuss these very sensitive topics to develop appropriate surge plans based on the forecasted need for our county.
I understand. So back to my question, do the hospitals, are the hospitals already in a situation where they're maxed out? If they had more equipment, they could not use it based on personnel? Or is there room to augment the equipment we have? And the reason I bring it up is we see the federal model seems to be every state for itself, competing and bidding to get equipment. If we wait until the Bay Area has the surge, we might find that there is no longer a supply of equipment. And so placing those orders today seems critical. You have New York talking about bringing in retirees to run ventilators. I don't know if California will see that, but I would hate to be in a position where the licensing rules are relaxed due to necessity, and yet we can't benefit because we didn't plan ahead on acquisition.
So thank you for the follow-up. I can't discuss the staffing capabilities of each agency. I'm not employed by those agencies, but I can tell you that they are assessing what they can bring in for additional staff to help support surge if needed at those facilities. I also wanted to bring up, we do have a program, it's called the DHV, and it's a disaster healthcare volunteer program. And it's managed by North Coast Opportunities by contract. And the DHV is very active today. There's a lot of communication. I am a member of the DHV to respond as a licensed paramedic and a disaster coordinator if needed in the state. So those communications have been being exchanged with the members, and we are trying to assess who we have available through our DHV support group to possibly volunteer their time to support this surge. The DHV list is a wide array of people, from doctors, respiratory therapists, nurses, EMTs, that can serve in different roles when we reach surge and need that support. So I do know that they are very engaged, and they are continually assessing what volunteers we have available today to provide support when called upon.
Understood. So we may get some additional staffing. When do you anticipate orders being placed for the additional equipment to back that staffing?
Well, as of today, Supervisor Williams, we have completed this survey with our hospital facilities, so we have a very clear understanding of how many ventilators and how many BiPAP machines we have available in Mendocino County. We are currently working with our hospitals to develop and understand each facility and their own surge capacity. I've heard from the state, the number right now, the focused control group number, is to anticipate 30% surge per each facility. And I know that our facilities are working to achieve that. Once we have a good understanding of their capabilities with their staffing, I think that gives us a strong number to move forward a resource request through the region up to the state if we do decide we need to order extra ventilators.
And roughly what would that date? Nobody's going to hold staff to it, but just so that we have a handle on the time frame and budgeting for the equipment, when do we expect those orders to take place? I understand we need to survey and analyze, look at staffing, but ultimately there's a drop dead date where we have to place an order or we won't get the equipment in time for the surge.
Well, so we have reached out the Mohawk branch. You have a team working day and night to ensure that we have resources continually coming into the county. So I want you to be aware of that. We've also been communicating directly with Jim Wood's office. They've been checking in every day to ensure we're getting the resources that we've requested to Mendocino County. And we have had preliminary discussions with that office to ensure we understand understand the process and the direction that we need to move should we need ventilators brought to Mendocino County.
Understood. Approximately what date?
Supervisor Williams?
I definitely don't have a date, but I think we need to have the proper work done to ensure we have the proper staff and the beds available to put patients on ventilators that need them in this county. Thank you.
Okay, thank you. Supervisor Brown?
No.
Okay, Supervisor McCowan?
Thank you, Mr. Chair. So I think I heard that the hospitals are planning for a 30% surge. Is that accurate?
Jen?
Thank you, Supervisor. We are anticipating a 30% surge, so we're asking the hospitals to provide us a surge plan for 30% surge.
Well, thank you. So if we currently have 45 ventilators available in the staff to operate them, we plan for a 30% surge. That's 14 or 15 additional ventilators, correct?
So, and just to clarify, that is a total surge for people who might need to be hospitalized because of COVID infection, not the percentage that Dr. Doohan addressed earlier in this call for the lower number of patients that might need to be put on a ventilator.
Okay, and also it's my understanding that we get to the number of 45 ventilators by essentially stripping them out of operating rooms. So once we have connected the first 45 patients to the ventilators, those ventilators are now dedicated for approximately 8 weeks. If emergency accident victims or any heart attack, anything else needing surgery comes into the hospital, we no longer have ventilators in the operating rooms. The point I'm making, the preparations that we're taking, we hope will be sufficient if we're able to flatten the curve through the public health officer order and compliance with it. However, I think we would be the first area that has successfully, substantially flattened the curve. If we're able to do that, we hope we are. But if we're not, if the community spread takes over as it has in other areas, our capacity will shortly be overwhelmed. So I just think we really need to emphasize to the public how serious this is and not really be sending the message, everything's under control. I think we need to help make people understand this is incredibly serious. People that they know and love are at tremendous risk if we don't successfully self-isolate. So that was more of a comment or a statement than a question. Thank you.
And thank you for those comments, Supervisor McCowan. I just wanted to add, when hospitals work on surge planning, they don't pull from their daily capabilities. So I'm sure their surge plan keeps their operating rooms open with physicians, staff, and equipment to do those emergent operations. As we did address during the PSPS event with our healthcare facilities, elective surgeries were often canceled, but any emergent surgery and the capabilities and the normal day-to-day function that our hospitals provide to this community, we anticipate to keep those running during this event, in addition to creating a surge plan to help support the public. And also, I'm going to let Dr. Flaherty speak on the hospital end as well.
Hi. Thank you for those questions, Supervisor McGowan. There's so many parts to this, and they actually all do fit together. So surge capacity, we're focused down on the hospital, but let's back it up to the surge in patients with COVID, whether they have a positive test or not. Because at some point, there's going to be very little testing, and we're going to assume if they've got the symptoms and they've been exposed in the community, that's what they've got. So the bigger number is the surge of 30% of what we have in the community over time. So that's a very large number of patients, but only a small number get hospitalized. And to get back to this issue of surge capacity and staffing in the hospitals with beds, there's a couple other things you need to know about ventilators. Not every bed can have a ventilator, okay? So if you have 50 beds, you can't have 50 ventilators. There's all sorts of technical requirements of hooking up that ventilator to the wall, and you could probably use a portable ventilator, but those are used for transport. And some of the spare ventilators might be for transport. And I want to just clarify one thing. I'm not contradicting Dr. Duhan, but I did hear some of the information that she gave about length of time on a ventilator differently when this was discussed. We are processing a lot of information, but I thought that the figure that was discussed with sick patients with ARDS in the ICU was that their length of stay was 6 to 8 weeks. Their time on the ventilator was 3 weeks. But that ventilator's tied up. And if that ventilator malfunctions, they got to switch the ventilators out. So I think we should focus on staffing and the equipment that they need to take care of them, the patients secondarily. Thank you. Any questions?
Thank you. And thank you. We started off with Sheriff Kendall. And thank you, Sheriff Kendall, for your efforts. And just, you know, the board wants you to know that, you know, your efforts in getting compliance on this shelter-in-place order are, you know, we're very supportive of what you do. And it might not always be popular with the public, but I think as far as healthcare goes, that's what's needed. So,
thank you.
Okay, CEO Angelo.
Thank you, Chair Haschak. To wrap this up, there was the press release that went out yesterday at approximately 5 p.m. was sent out also to all staff and each board member. So if by some chance one of you did not get that press release, then we will go back and check the email listing, but you should have all gotten it. I don't have it in front of me, but Dr. Duhan wanted to be certain that you all got that press release. It was very clear on social distancing and the actions that need to be taken by the public, and also up to and including the enforcement that is done by the sheriff's office. So I just want to be sure that if you hadn't had an opportunity to read that press release, if you would go back and read it. I think that as far as the most pertinent actions at this time, testing, shelter-in-place enforcement, equipment needs, daily operations, I think that the team has covered that. I don't know that there have been any additional questions, comments, or suggestions around shelter-in-place. Dr. Duhan has to get off of this call at 10:30 to go on another call, so I don't know if there were any final comments on the shelter-in-place order. It is still in draft, and Dr. Duhan will release that, will finalize that and release that later this afternoon. I would like to just end by saying that Dr. Duhan has been exemplary in her clinical expertise in reviewing COVID-19, has been a researcher in looking at all this information and bringing us the best practices. Sometimes there are just things that overtake us, and it doesn't matter how well prepared we are. And you've heard about all the preparation, all the equipment, what the needs are, and what we've done to enlist the resources for those needs. But sometimes we just are overtaken. And while we're doing everything we can, including Sheriff Kendall as far as enforcement, certainly Dr. Duhan and Dr. Flaherty, it is a situation that is hour by hour, day to day. If you're following what's happening in New York, it's astounding. One of the comments that was made by one of the leaders in New York today was that moving from social distancing to social lockdown may be the only or the greatest effort to trying to mitigate COVID-19. We certainly hope that the public will continue to listen to the leadership regarding social distancing. This board, each one of you has asked what you can do to assist your team in the COVID-19 response. I would just like to remind this board that it is your leadership that moves us forward, and anything we do is really at your direction. The health officer, of course, is the one responsible and the one that has the best body of knowledge to develop the health officer orders, the public health orders, and move us forward regarding epidemiology and finding the illness and tracking the illness and attempting to mitigate the illness. But you are the leaders of this county, and what you say goes as far as me and the 1,200 staff that report through this county. So I just want to make sure that you know that we are here, and we are here to take your direction. You make the policy, you give the direction, and we implement it. So thank you for your interest, and we will continue to do the daily calls with the board, and we will also have a standing item on each board agenda for COVID-19 until we get through this public health event. That's all I have, Chair Hashjack.
All right, thank you. I guess my question is for County Council at this point. Do we need to take public comment on this off-agenda item?
Mr. Chair, I would suggest adhering to the same process that we use for these meetings for all public comment.
Mr. Chair?
So my question to the clerk is, have there been any comments posted?
All comments have been uploaded to the item and pushed for you and the public to access.
Thank you. All right. So with that, are we done with that issue?
Mr. Chair?
Yes.
This is Supervisor Brown. I wanted to make sure that our press releases go on our website, because many people in the community, that's how they're getting their updates.
Okay.
So I hope that occurs.
All right. Are there any other comments from the supervisors? Okay, I'll go down the list and I'll start with Supervisor Williams.
Yeah, I appreciate the CEO's comments about board is setting policy, but given the emergency and our meeting schedule and the other items on the agenda, we're not involved in the order that's about to go out, even reviewing it. I think that's a failure because additional eyes may spot that the language, although set by somebody very competent, may not be read in a way that leads to the best implementation. Spotting that early is critical. I'm confused as to why we're not having internal review before it goes out. There's a need to meet before April 7th. At the pace this is progressing, I think we should talk about that and meet about this and only this. Other items that seemed important a month ago don't seem so important today.
Okay, Supervisor Brown, you already commented. So Supervisor McCowan.
Thank you, Mr. Chair. Supervisor Williams noted earlier that he and I had been trying for at least a couple of days to have input to the public health officer order. We have quite a number of specific areas where we think the order could be strengthened or clarified. I hear the comment by the public health officer that the order was delayed for a day so that the supervisors, the 5 of us collectively, presumably could have input. It does not seem that there's a mechanism set up to receive that input or be able to have any feedback with the intent to have the order be as clear and strong as reasonably possible, and understanding that the order is the public health officer's order. It will ultimately be what she decides to send out. But I do think the order could be strengthened with input from the supervisors, particularly who have been closely involved in issues that come up around the interpretation and enforcement of the order. Thank you.
Supervisor Jurdy.
No.
All right.
Mr. Chair, if I may.
Yes.
Thank you. Christian Curtis, Acting County Counsel. And I just wanted to respond to some of the comments of Supervisors McCowan and Williams just briefly. As Supervisor McCowan noted, it is the order of the health officer that is going out. It's not an order of the board. That's by statute. The way that this is set up is that in the emergency, the powers are actually vested in the health officer, who is the person who has to be able to move very quickly and to issue some of these orders very quickly. Some of these, there has been some level of review and input, but some of these, it has been very, very quick. Actually, the very first order that went out on this one, I believe that the health officer was working with my office and with EOC staff to get the order out within a span of it was less than half a day before it went out. In terms of having sort of a meeting process or a mechanism to review the orders, I don't know that the emergency is especially conducive to that. I have forwarded some input from supervisors to the health officer, but I don't know as a practical matter that there's really going to be the mechanism to allow the board to be having some opportunity to sort of draft and revise or be offering that level of detailed input, just given the time frame that we're working on here. And again, that's in part because we're dealing with a particular statutory structure that's designed for these emergencies that recognizes that putting it out through a public meeting, putting it out to the elected officials as opposed to the medical expert may slow things down and may cost us valuable time. I'm certainly mindful of many of the comments that have been made regarding the ambiguity of the orders. We have been challenged, not just in the fact that the orders were initially drafted by the Bay Area, so we were playing catch up as they hadn't shared that information with the other counties, but also that the governor's order injected a significant amount of ambiguity into the overall legal framework here. I will say that my office is working very closely with the health officer. We are trying to make sure that we get these reviewed and vetted and get all of these issues tackled as best we can. And if you have any particular concerns, if you do want to send them to me, I'm happy to take to go over them with the health officer and address them during the process. But as a practical matter, I just don't know that there's going to be any mechanism for the sort of review that may have been mentioned here.
Okay, thank you for those comments.
Chair Haschak.
Angelo, yes.
I would just like to add that we certainly could schedule additional board meetings. We have a schedule set. However, we're in a local emergency. We could meet every week, every day, if this board would like. We have relaxed Brown Act requirements. So, as you know, we are doing a phone call with this board daily to be sure that you get information. If it is an issue of you giving direction to us or input on what's done, whether it's a public health order or it's something that's operational, there is a process in place. However, if you would like to schedule additional board meetings, we certainly could do that. And we do have a board meeting 2 weeks from now. My expectation was that we would have another board meeting before that, just because we would need to call one. But I know we don't have it on the agenda, so I would defer to our chief counsel. But if this board would like to schedule a meeting next Tuesday, which I believe is the 31st, and then of course we have a board meeting on the 7th, knowing that you will get a phone call daily in between, that we could do that. The other option is today is Tuesday. We could schedule a board meeting for Friday if you would like. We could have 2 board meetings a week if you would like. Whatever this board chooses. What I want to be clear on is that I really don't want any board member to think that they have input and we're not taking it, or they have recommendations and we're not taking it. There's a process in place. We're trying to follow the process so that the staff that are working on this, Dr. Dewan, Dr. Flaherty, Sheriff Kendall, that they can actually do their work. There have been multiple questions that are extremely lengthy that have been submitted by some of the board members, and staff is trying to answer those questions, but they're also trying to respond to this event. I would welcome having another board meeting before April 7th. Would certainly welcome giving this board information and using that venue to take your questions as well. I think that County Council Curtis answered the question about the health officer order at this time. But Chair Haschak, as chair, if you would like to direct us to schedule another meeting either Friday this week or Tuesday of next week or tomorrow or whenever you would like, we could do that. We will have a smaller group because people are working in response to this item. But I will be here, our clerk, Lindsay Dunham, will be here, and I will have one deputy in the room. Thank you.
All right, thank you. I think that we probably should have a meeting next Tuesday, but I don't want to, have meetings take away from the work that the CEO and the public health officer are doing, because for every meeting that we have, it takes a lot of time and effort, and certainly we need to be focused on the best thing for this health emergency. So as far as, why don't we set up a meeting, but just have it dealing with the COVID-19 crisis that we're in. And as far as the public health orders, I think that what County Council said is totally right about, if you do have comments, send them in to the public health officer or the CEO or County Council. But I think for the political realm of the supervisors to have oversight or another step in that process is probably going to be too cumbersome. And I'd like to leave those public health orders in the realm of those health officers who are working on it. So that's where I am with it.
Chair Haschak, I would defer to our chief counsel if we need to take another off-agenda item to schedule a meeting on March 31st, or if we could just go ahead based on the chair's direction at this point to go ahead and schedule a meeting for March 31st, 9 a.m. That will be another COVID-19 Board of Supervisors meeting only. And I do have to say, unfortunately, we are working on nothing else but COVID-19. All the board directives, everything else, we are not doing anything but COVID-19 and trying to keep this organization going. Thank you.
All right, thank you. Is there anything else we need to do around this issue?
Mr. Chair, if I may just answer the question that was posed by the CEO, the chair does have the ability to set a special meeting. So by chair directive, the chair simply wants to set that date, we can proceed.
Okay, so let's set it for next Tuesday, which would be the 31st.
Okay, I have direction by order of the chair to add a special meeting to Tuesday, the March 31st at 9 a.m. Excuse me.
Right. Okay, thank you. Anything else we need to do around this issue? Okay, so why don't we take a break right now for 15 minutes until 10:55. All right.
And we're on.
Okay, so is everyone on except for Supervisor McCowan?
Hello?
Okay, very good.
Wait, I'm here. We're not in sync with muting and unmuting. I'm asking staff to only unmute me when I'm called on by the chair, and you have the control of the mute and unmute, because it's not in sync on my end.
Okay, can staff do that then?
Okay, we got it. Thanks.
Okay, very good. Thank you, Supervisor McCowan. And that's a good reminder for everyone to, in this situation, to talk through the chair. So that would help me keep things organized, and I appreciate it. So we're on to the other off-agenda item, which is discussion and possible action, including adoption of urgency ordinance enacting restrictions on commercial and residential evictions in Mendocino County through May 31st, 2020. And my question is, since this is an urgency item, is it possible to postpone it until next Tuesday? And I'm going to put that on to Supervisors Williams and McCowan.
Mr. Chair, I would say no, there's definitely an urgency. People are struggling to be able to pay their rent, both commercial, residential. They're being told in some cases by their landlords, sorry about that, you will be evicted if you don't pay. I think this can be a very quick item. And again, we would first have to make the findings to add it to the agenda, then we could take action. I don't think it has to be a drawn out discussion. I think the measure speaks for itself. Thank you.
Supervisor Williams, you agree with that?
I do.
Yeah. Just my idea was that, if we could have more transparency, public input, but we will go ahead and consider it. Okay, so County Council, we need to consider this as an urgency item.
Yes, Mr. Chair, as with the prior item, there needs to be a vote making a determination that an emergency situation exists, that this item is related to the emergency situation, and it needs to be a simple majority vote.
Very good. Okay, so clerk, could you do a roll call on the vote?
Sure thing. Supervisor McCowan?
Did we make the motion?
Supervisor McCowan?
Well, yes, thank you. Did we make the motion to add it, make the findings and add it? Do we have a motion?
Okay, very good. Could you make the motion, Supervisor McCowan?
I move that to make the findings necessary to add this item as an off-agenda item.
All right, is there a second to that?
Second.
Very good. All right. Okay, clerk, could
Okay.
you?
Yes. Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
Thank you. The motion carries.
All right, very good. Hey, Supervisor McCowan or Supervisor Williams, would you like to speak to this item?
Well, thank you, Mr. Chair. Again, I think the item is self-explanatory. I think given the fact that we have many businesses closed, we have many people suddenly unemployed, and both many of the businesses and the individuals do not have the financial reserves to cover rent and all the other necessities of life. It is important to point out that consistent with the governor's order, this measure is limited. It would extend protection against a new eviction, I believe, through May 31st. And also, it does not relieve anyone of the obligation to pay rent. And in fact, I believe, and we can go to County Council for clarification, I believe a landlord could still take whatever action they think is appropriate lawfully in order to try and collect rent. They simply would be barred from evicting anyone for non-payment through May 31st, consistent with the governor's order. And so those are my comments to the item, and I would request to be muted again.
Okay, Supervisor Williams?
I know businesses and individuals are coming up on end of the month, first of the month, where they have to make some decisions with a lack of cash flow. And there's a benefit in passing this today to instill some confidence that action will stop until the peak of COVID passes.
All right, Supervisor Brown.
Yes, my concerns with this is the fact that there has been comment that has come through to all the board members regarding this particular issue. Also read, I believe it was an article in the paper, and because of it being an urgency item, the public that may want to weigh in on this, that may be opposed, have not had their time to do so and prepare.
Supervisor Jurdy.
I understand that there could be concerns by landlords, but on the other hand, they are not waiving their ability to collect the funds for the rent. But, you know, on the other hand, we can't really see people being kicked out on the streets in the middle of this crisis. So I'd be supporting the proposed ordinance.
Barry, you're muted. Could you unmute? We can't hear you.
Oh, sorry about that. So my comment was that this only deals with rentals and non-payment of rentals and those evictions, not foreclosures or anything that has to do with the bank. Is that correct?
Mr. Chair, if I may, I believe it does address foreclosures in a limited capacity. And actually, if you would give me just a second, what I might do is get my deputy to come in here to speak to that point just briefly.
Okay, and my concern also, I agree with Supervisor Brown, is that, you know, in the best case scenario, we would have time for public comment and get input on this. Hey, County Council?
Mr. Chair, if you give me just one moment. If I may, I'd like to ask Deputy County Counsel Mike McAtee to speak to the question that you had posed earlier.
Very good.
Good morning, Board. I believe the question was whether or not this deals with foreclosures and banks, and my understanding is that it does. It's this basically, and without having looked at what we wrote yesterday, this morning, what this deals with is it stops the ability to evict somebody, whether it's through a rental, both residential and commercial, whether it's just a person renting or somebody who has purchased it and is paying off the bank, and the bank is looking to evict after a foreclosure. It prevents that eviction based on non-payment of the rent or of the amount of money that would go to initiate the foreclosure. Again, the person that owes the money would still owe the money. It just prevents the eviction from happening during this period of time. And I hope that answered the question.
The foreclosure would still happen, just the eviction process itself would not happen.
Deputy County Counsel Michael McAtee, I would have to go back and look at the exact wording of what the executive order stated and what we were adopting, at what point the foreclosure would happen. I mean, so if you could give, I mean, I would need to go back and look.
And if I may, Mr. Chair, I believe the relevant link, there are references to foreclosure specifically within the ordinance. I'm noticing in particular 5A and 5B. I don't believe that it went quite as far on foreclosures as we have gone with respect to evictions, and that's in part due to the limitations that were put in place by the governor's executive order. The draft that we used was an attempt to get as close to the full extent of what the governor had authorized local jurisdictions to do under the latest orders.
Okay, thank you.
Thank you.
So we have some public comment on it. One piece of correspondence. That's noted. Okay, so any other comment from the board?
Yeah, I have one comment.
Yes, Supervisor Williams.
I think an eviction at this stage would go against the core intent of the social distancing. Eviction would involve contact, would involve preparation for the eviction, movers, potentially renting a vehicle. There's so many points of contact that come into play during an eviction. All we're asking is that we continue the goals of social distancing until this pandemic passes.
Okay, very good. So no other comment from the board. I'm going to ask for a vote by the clerk.
We need a motion?
Oh, okay.
I
Is
would
there a
move
motion?
recommended action.
All right. Is there a second?
I'm sorry, can you say your name before making a motion? Thank you.
Williams moves the recommended action.
Thank you very much.
Is there a second?
30 seconds.
Okay, Jurdy with the second. All right.
Okay.
Oh, clerk, could you conduct the roll call?
Yes, I
vote?
can. Supervisor Jurdy.
Yes.
Supervisor Williams.
Yes.
Supervisor Haschak.
Yes.
Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
The motion carries unanimously.
All right, very good. We needed to talk about the schedule for today and if we want to do a working lunch. So we do have closed session items, and we also have, we have closed session items that we need to get to. So would everyone be amenable to a working lunch today? Let's see, Supervisor Jurdy.
Sure.
Supervisor Williams.
Yes.
Supervisor Brown.
Chair Haschak, if we get a short break in between,
Yeah, we'll have about 15 minutes.
so I'm fine.
Okay. And Supervisor McCowan.
Yes, thank you, Mr. Chair. I would suggest we try to complete our open session before going into closed so that public trying to watch at home at least has continuity of being able to see through the open session items.
We're going to do the best we can. Thank you. Okay. So we're going to have a working lunch, and we're going back to agenda item number 4, the consent calendar. So clerk, has there been proper notice established?
Yes, proper notice has been established.
Okay, are there any items to pull for separate consideration? Seeing none, hearing none. Okay, is there a motion to approve the consent calendar?
I'll move to approve the consent calendar.
Thank you. Is there a second?
Mr. Chair,
Yes.
was there a call for public comment?
All public comment has been attached to the item and pushed to you and the public.
Okay, I have further comment about that. So the listening public or the watching public knows that their correspondence been received. I think it should be verbally stated what is received and from whom.
Okay, thank you. Let's see, clerk, could you read off any correspondence?
Just a moment, please. My program is frozen. I'm sorry. Just give me a moment. With regard to consent calendar specifically, there was no correspondence received.
Okay, thank you. Okay. So we had a motion to approve the consent calendar. We don't have a second yet.
I'll second.
Okay, thank you, Supervisor Brown. All right. Clerk,
correct.
Conduct the roll call.
Supervisor Williams.
Yes.
Supervisor Hashchak.
Yes.
Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
Supervisor Jurdy.
Yes.
The motion carries unanimously.
Okay, thank you. Okay, agenda item number 5A, which is discussion and possible action, including adoption of resolution amending the position allocation table as follows. Administrative cleanup to budget unit 2851 by adding 1.0 FTE building inspector 2 and a 0.5 FTE planner 3, previously approved in fiscal year 19-20, budget by resolution 19-200, budget unit 2810, which is delete 4.0 FTE agricultural standard specialist 3, add 4.0 FTE planner 2, delete 1.0 FTE cannabis program manager, and add 1.0 FTE chief planner. Human Resources and Planning and Building Services are the sponsors. Is there anyone here to speak to that?
Let's wait and see. Johnny Cranmer, Human Resources Manager, and I believe your Planning and Building Director, Brent Schultz, will be available electronically. This item comes before you as a result of the administrative cleanup to add the 1.5 positions that were funded during the budget fiscal year 19 and 2020, but were not added to the position allocation table. No additional funding is needed for this as they were already funded. And the second item related to the cannabis program, in order to create a more efficient functioning cannabis division, the Planning and Building Services requests these changes, which is to delete 1 cannabis program manager and add 1 chief planner, and to delete 4 agricultural standards specialists and add 4 planner 2 allocations. Some of these positions are currently funded, some will need funding, which Mr. Schultz will address. Human Resources supports this request from a classification aspect, in that these classifications will more directly reflect the work that is being performed and that needs to be performed. And there's also hope that these changes will assist with recruitment and retention of cannabis division staff. And again, there are funding issues which Mr. Schultz may speak to. There's a staff report from Planning and Building and a budget estimate attachment as well. I'm available for questions, as is Mr. Schultz.
Any questions from the board? I guess my question is that making the cannabis manager have that title of chief planner, and I understand that there's certifications and experience needed for the chief planner. So Is that equitable there? Is that the right thing to do?
Supervisor Hashik, this is Brent Schultz, your Planning and Building Service Director. If I could address the board on that.
Certainly.
That chief planner position, my feelings on that is to create a standalone unit in cannabis where it is run by a chief planner. Obviously, there are qualifications for that position, but we could underfill that position if it's added to the position allocation table, and if it's funded in the budget, we could underfill it with people who have the correct qualifications, or if somebody has those qualifications when we open it up, we could place them in that position.
Thank you. Any other questions from the board? Okay, seeing none, I'd like to note any public comment on this. So clerk, did we receive any public comment?
All comment has been attached to the item.
Okay, thank you. And so going back to the board, is there
Mr. Chair?
Yes, Supervisor Brown.
Thank you, sir. I move the recommended action.
Second, Williams.
Okay, so it's been moved and seconded. Okay, so any further comment? All right, clerk, could you conduct roll call vote?
Yes, continuing with the rotation. Supervisor Haschak.
Yes.
Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
Supervisor Jurdy.
Yes.
Supervisor Williams.
Yes.
The motion carries unanimously.
Okay, very good. Moving on to
Thank you.
agenda item 5B, discussion and possible action including introduction and waive first reading of an ordinance adding chapter 10A.18 industrial hemp cultivation pilot program to the Mendocino County Code. So this is sponsored by the Agriculture and County Council. Personally, I'd like to see this tabled until a future meeting. I think we have a lot of other things to do instead of dealing with this, and this seems to be somewhat controversial. And so I'll just leave it at that if anyone wants to make a motion to table this.
Williams.
Okay,
So moved, Mr. Chair. This is McCowan.
Second, Williams.
Okay, so it's been moved by Supervisor McCowan and seconded by Supervisor Williams to table this for a future meeting. Okay, is there any public comment on that?
It's attached to the item.
Thank you.
Okay,
Yes, it's been attached to the item.
Yeah, well, those were about the item itself, about the, I don't know how we do this with the motion to table it. So,
Mr. Chair, if I may, I believe that the county actually has the capacity for the emails as they're coming in to be uploaded. So if there is any public comment coming in at this time, I believe that it would be uploaded to the item, and I would ask that the clerk could just confirm that and confirm whether any comment has been received on that.
I can assure you I am doing my absolute best to keep up with public comment in real time and attach it to each individual item in the program and push it to both you and the public. I promise you that.
okay, very good. So it's been moved and seconded that we table this for a future meeting. Okay, any further comment from the board? Noting that there are no
Mr. Chair?
new comments from the public. Yes, Supervisor Brown.
I think it's very appropriate, and I appreciate the motion, and I feel that the comments coming in, it will give people more time, and maybe we won't be under such strict orders for that particular board meeting when it comes back, because there has been a lot of comment. There's been some last minute comment that I know I haven't had time to go over.
Okay, thank you, Supervisor.
Mr. Chair, I do have one comment. We might check with County Council. We do have a moratorium. We have extended the moratorium. Could we verify with County Council or other staff when that moratorium would expire? And with that in mind, that might tell us when this item needs to come back for board action.
Very good. County Council?
Thank you, Mr. Chair. My understanding is this moratorium will expire in February of 2021, and I believe we have Deputy County Counsel Matt Kudrowski in the meeting as well. He may be able to verify the exact date.
Deputy County Counsel Matthew Godrowski, that's correct.
Okay, thank you very much. Thank you for bringing that up, Supervisor McCowan. So I think that we're clear if we table it, we can deal with it at a future point when we're not dealing with a crisis. And that would be fair for everyone for, substantial input. So we have a motion on the floor. Can we have any further comment from the supervisors? Okay, Supervisor Brown? No? Okay. So clerk, could you conduct the roll call by?
I sure can. So Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
Supervisor Jurdy.
Yes.
Supervisor Williams.
Yes.
Supervisor Haschak.
Yes.
Thank you. The motion carries unanimously.
Okay, very good. Thank you. Okay, agenda item 5C, which is discussion and possible action, including approval of retroactive amendment to BOS agreement number 18-170 with Redwood Quality Management Company, increasing the amount from $1,485,000 to $3,002,300 and extending the end date from December 31st, 2019 to December 31st, 2020 to participate in activities relevant to the implementation of Mendocino County's Whole Person Care Pilot Program and provide direct service, facilitation, administration, and participant-specific data as funded by the County of Mendocino Whole Person Care Pilot Project effective January 1st, 2019 through December 31st, 2020. The sponsor is Health and Human Services Agency. So is there anyone here? Is Director Tammy Moss Chandler here or anyone to introduce this item?
Good morning, Chair Haschak, members of the board. This is Tammy Moss Chandler, Director of Health and Human Services. I appreciate you hearing this item today in the midst of this emergency and our very busy schedules. This is the final pilot year of whole person care for Mendocino County and many counties across the state. We've been working with our state and federal partners about how aspects of whole person care might continue in the future of the Medicaid Medi-Cal waiver that the state and federal government have, and how that's going to be implemented in fiscal year 2021, beginning in January 21. So this is a very important year for whole person care, and it has provided a substantial amount of wraparound services and flexibility for things that we're not able to bill to Medi-Cal under our current state and federal arrangements. It's allowed for peer and unlicensed support workers to be wellness coaches for individuals struggling with mental illness. It's provided additional bridges in our communication with our clinic partners and our behavioral health system. It's allowed us to implement several creative aspects of quality improvement in these services, and also has provided transitional services, even though it's not permissible under current Medi-Cal and Medicaid rules to pay for housing on a permanent basis. This grant funding and pilot program has allowed us to pilot transitional support services to help people have the stability to transition from homelessness and receive the treatment services they need and stabilize into permanent supportive housing. So with that, I am open to any questions and appreciate the board considering this action today.
Mr. Chair, I believe you're on mute.
Are there any questions from the board? Comments? Seeing none and hearing none, are all public comments noted? Clerk?
All public comment has been attached to the item.
Okay, very good. Let's see, back to the board then. Is there?
Mr. Chair?
Yes, Supervisor Brown?
Thank you, sir. I'd like to move the recommended action.
Is there a second?
Second.
Okay, Supervisor
Second.
Brown with the second. Thank you. Okay, any further comment from the board? Okay, clerk, could you conduct the roll call vote?
Sure thing. Supervisor McCowan.
Yes.
Supervisor
Yes.
Jurdy.
Yes.
Supervisor Williams.
Yes.
Supervisor Haschak.
Yes.
Supervisor Brown.
Yes.
Thank you. The motion carries unanimously.
Okay, very good. Moving on to agenda item 5D, Chief Executive Officer's Report. CEO Angelo.
Thank you, Chair Haschak. I have nothing further today except to say that we are doing everything we can to serve the public during this time. We do have offices that have closed to the public, and we do have staff that are working emergency services 24/7. So that really is all that there is right now. We are certainly focused on the COVID-19 event, and that seems to be taking up time really in all the departments. So thank you. I'll have a longer or a more inclusive report next week. Thank you.
Any comments from the board? Just one question, CEO Angelo, is that my understanding is that all staff, even if their department has been closed down, will be transferred or placed into a position of as disaster service worker or some other position as needed?
Chair Haschak, thank you for the question. Our goal is to keep services open as much as possible and to keep our employees working as much as possible. So the way that we have it set up is the department is instructed if they believe that they either need to close or they must close or whatever, they close their department. Those employees that are essential will work in that department behind closed doors. If they have employees who are providing services that are not necessary at this time, that employee will either transfer for this period of time to a department that needs additional assistance or to the emergency operations center, the call center, some area that's needed to respond to COVID-19. Our goal, again, is to keep our employees working. They are all disaster service workers, and they're needed. I did receive some concerns about employees in the call center and working long hours in the call center. When you're a disaster service worker and you're in an emergency like this responding, there are times that you have to work over 8 hours a day. And so we are watching that. We are actually including more employees in the call center so that we don't have our employees working 12 and 16-hour shifts like the leadership is doing. So we are working on that. If any board member hears of an issue or a problem regarding our employees being disaster service workers and responding in this event, I would like that information given to our Human Resources Director, William Schertz. It helps to have an area to go to, and Human Resources is that area. What we're trying to do is squelch rumors out there, and so if a board member gets a call and you hear this and you want to check it out, please take it to Mr. Schertz. Thank you.
Question.
Okay. Thank you, CEO Angelo, for that clarification and update. Right.
Question.
Yes, Supervisor Williams.
Yeah, question for the CEO. I know that the core team at the EOC has been working together. And as we see a surge, there must be some amount of risk in the exposure, no matter how much distancing is attempted within the EOC. What is the plan for if the core decision makers become ill and need to step back? Is there a written plan? Can the board review it? Is that something that could come back next meeting?
Chair Haschak, Supervisor Williams, we could bring you a plan next week. I can tell you right now that within the Emergency Operations Center and the response from executive office staff, we are breaking out our schedules where we're not all here. So some of us are working from home, some of us are working in the office, some of us are working in the EOC. And we have also taken employees in the EOC and moved them around so that there is 6 feet distance, and also some will be going back to their departments and working from their offices. However, to answer your question, we will come with the plan next Tuesday. Thank you.
Okay, thank you. Any other comments from the board? All right, so.
Thank you, Mr. Chair. John McCowan here. Yeah, I think it could be helpful also if we had a written plan of, and I know that the executive office, the people working in the EOC have been working on at least a dozen different items to try and plan and try and get ahead of the crisis that we're in. I think it would be helpful to have a written report of the different subject areas and what is being done. So we have obviously the issue of trying to secure sufficient equipment for the hospitals based on their capacity to actually use that equipment. We're working to secure alternative sites where people could be housed who need to be isolated or quarantined. We are working on trying to secure housing for the homeless. So there's multiple different fronts. Even a paragraph on each of those topic areas that they're working on, I think would be helpful in informing the public as well as the board as to the actions that are being taken and the progress that has been made. Thank you.
Chair Haschak, we have a daily incident action plan. We have an incident briefing. We actually brief in the morning at 10 and in the afternoon at 3:30. I will see about having a copy of the incident action plan given to this board. I really hesitate to ask staff to begin to write out a report. I'm not certain what Supervisor McCowan wants. I mean, I understand a paragraph on each. There's a lot of work being done. I'm sitting here with a 10-page report in front of me. I will gladly share that report with the 5 of you rather than writing out another report. So Tuesday of next week, you will get a copy of the incident action plan, and we'll see if that's appropriate and that meets your needs. Thank you.
Thank you, CEO Angelo. And I don't think the intent was to put any more work on you. So I think what you give us next week, we can look at, and hopefully that will suffice. So moving on to agenda item 5E, discussion and possible action, including review, adoption, amendment, consideration, or ratification of legislation pursuant to the adopted legislative platform. Okay, the sponsor is Executive Office, is Deputy CEO Sarah Duquette.
Chair Haschak, no. Deputy CEO Sarah Duquette is our Chief Public Information Officer in this event, and she is responding to calls, emails, social media related to this meeting that we're currently in, and also to the information shared by our health officer that preliminarily we have a second positive case that they're being worked on. So I don't have Sarah in here today. What I can tell you is that we are working with our statewide associations and the state. I talked with Senator McGuire just yesterday. And basically what we're all doing, of course, whether it's at the state or federal level, is responding to this. We will have a report for you next Tuesday, but right now we don't. And just as you know, and this board has been quite supportive, things change hourly. And so best laid plans of what we'd like to provide and what we actually get to provide may be two different things. But we will work to give you a legislative update next week on COVID-19. Thank you.
Okay, and thank you, CEO Angelo. And I'd just like to remind the public that you are the chair of the county executives and for the state. And so you have quite a bit of influence and communication going on with the CSAC, which is the County State Association, California State Association of Counties. And so with that, I think that we're very well represented in Sacramento with our concerns. And thank you for your service on that, in that role. So seeing nothing else, do we need a motion to accept this report for County Council?
Are you talking?
Or CEO Angelo?
We can withdraw that until next week, until our board meeting scheduled on the 31st, please.
Okay, very good. All right, Supervisors Reports, agenda item 6A. Okay. So we'll start with Supervisor Brown.
Thank you, Mr. Chair. And as we all remember, at our last meeting on the 10th, we ran out of time and Supervisors Reports were not given. And I was going to ask a question, and that question happens to be, are we going into another drought? Although we have seen some rain. In early January 2014, the Board of Supervisors did declare a drought emergency and appointed a countywide drought task force. At this time, we are in a moderate drought year. And I just wanted to bring this up because I believe it's important for each of us to keep this in mind depending upon what happens this spring with our rainfall totals, and keep track of the different districts, the municipalities that have their own water supplies and delivering to constituents. But I think we need to keep our eyes and ears open as we go into the summer. So I did attend the following day, March 11th, after our board meeting, Rural County Representatives of California Board of Directors meeting. And we did have a guest speaker, Tyson Eckerly. He's the Deputy Director of Go Biz, and that is the Zero Emissions Vehicle Infrastructure Unit within the Governor's Office of Business and Economic Development. And he was there to talk to us about Assembly Bill 1236, and that was passed in 2015. That mandated all municipalities to streamline electric vehicle charging stations permits in order to expedite the availability of electric vehicle charging stations. So cities and counties across the state were required to adopt such an ordinance. Our timeline in adoption would have been September 30th, 2017. And I do want everyone to know that we're not alone in noncompliance because we have not done that. There's many cities and counties that have not. But Go Biz has been tracking AB 1236 compliance. And due to the lack of compliance with the requirements, Electrify America is sponsoring legislation this year to further expedite the permitting applications for the charging stations. AB 2168 would deem these charging applications approved 15 days after submittal to a city or a county if the building official has not made a finding that the installation of an EV charging infrastructure would not have an adverse impact upon public health and safety. So what I've done, we were given quite a packet, and I've taken that packet of information. They have a plate full of directives from this board to get on over at Planning and Building Services, but that's where I took it and delivered it. So we'll see how soon they can get to it and what happens as we go forward. There's also at the RCRC meeting, there was much discussion about sponsored legislation. And I think one of the most important ones has to do with AB 2612, which would continuously appropriate $200 million annually from cap and trade auction revenues, with $100 million allocated to in-state solid waste recycling programs and in-state organic waste recycling projects. So that is one we really want to watch because we all know about the recyclables and what is going on and the new requirements we're going to be hit with as far as organic waste management. So I fully supported that, and so did the board of directors. Then also, RCRC has been working closely with Assembly member Freddie Rodriguez Pomona on Assembly Bill 1936, which would apply existing anti-price gouging protections to PSPS events. Again, I felt that is something that we could fully support. There was also proposals and legislation impacting the homeowners insurance market. Won't go into detail with that. But other updates that RCR staff gave had to do with forest management and wildfire, the governor's homelessness budget proposals, water issues, including the Sustainable Groundwater Management Act, fair allocation rulemaking, federal National Environmental Policy Act and the rulemaking there that's being addressed. And you can go, anyone from the public or any one of you as supervisors can go to the RCRC website in order to access all the details and the updates. There was also California Public Utilities Commission update and the proceedings that are going on how utilities undertake wildfire hazard mitigation and de-energization of power lines that I know you're all interested in. Golden State Finance Authority also had their board meeting the same day. Some of the actions taken, authorizing appointment of a GSFA multifamily action team, sending a GSFA letter to State Treasurer Fiona Ma requesting she support the restoration of the California Debt Limit Allocation Committee mortgage credit certificate program, and that we requested she directs CDLAC to reconsider its defunding of that program at its next regular meeting. And I might add that State Treasurer Ma sits on it along with the governor and other top California officials. I also, we had a Ukiah Valley Basin Groundwater Sustainability Agency meeting. We discussed the current financial status of the agency. It was determined an additional $3,000 from each contributing member agency was needed to fund the GSA for the next 2 years. The board of directors approved that assessment, and so there will be a bill coming to the county, and I'm hoping that we can come up with the $3,000 in order to pay that. An update was given on the Proposition 68 Sigma grant program by staff and announcing that our application is recommended for full funding. Larry Walker and Associates presented an introduction to the development of the sustainability goals for Ukiah Valley Groundwater Sustainability Plan. The board asked questions and provided comment to a number of the questions presented by Larry Walker and Associates. The Russian River Public-Private Facilitating Committee meeting was canceled due to COVID-19. Inland Water and Power Commission did meet. They received a status report on the two basin partnership efforts to license the Potter Valley project, along with other agenda item updates. Further discussion did take place regarding the Corps of Engineers potential action to terminate the Coyote Valley Dam feasibility study. The Behavior Health and Advisory Board meeting was canceled. I was able to attend one of 4 Redwood Valley home dedications, and these are the homes that were built by the Mennonites. So I was very pleased and to be able to be there for that individual that was burnt out of a home and now gets to go into a new home. There was also a Caltrans public meeting, mainly an open house on the 2-bridge replacement project that will be in the Redwood Valley area. That is the bridge at on Highway 20 as you're getting close to going up on Highway 101. So that's the overpass, and there's also a bridge that they call the underpass. So there was information on that, and hopefully there'll be more because they didn't get a very good turnout due to COVID-19. The Sustainable Ag Lands Committee did meet remotely, went over the grant requirements and also the deliverables. And that's it, sir.
Thank you. Supervisor McKellen.
Thank you, Mr. Chair. I did attend an evening of gratitude recognizing Mennonite Disaster Services for their volunteer labor rebuilding 4 homes in Redwood Valley. Presented the proclamation that this board adopted. It was very well received. Several of the families were there. It was really a bit of an emotional evening with the gratitude that those families had for getting back into a home who otherwise would not have had one. The other item I'd like to mention is the board did previously give direction for a letter to be sent reflecting the concerns that SEIU 2015 had raised regarding in-home supportive services and the clients that they serve. The workers and the clients are some of the most at-risk individuals in our community. And I just wanted to get an update on, did that letter go out? Because I haven't seen anything in any of the governor's orders or ours that address some of the concerns that were raised by SEIU 2015. And so this letter of support was just an intent to try and get this issue on the radar for the state so that those concerns can be addressed. So again, just an update on did the letter go out, or if not, when could we expect it to? Thank you.
Okay, CEO Angelo, do you know if that letter went out?
Chair Haschek, I do not know if that letter went out. We will check and we will give you an update. I hope to say by our next meeting that we could tell you it went out, but right now I have no idea.
Okay, thank you. Supervisor McKellen, are you done?
Yes, sir.
Okay, thank you. Okay, Supervisor Jurdy.
A number of my committees have been postponed for the month of March. Their technology capabilities aren't as good as the counties. So the recycling agency, I expect by April, will be video conferencing our next board meeting, meant to recycle. MTA, same thing there. One thing is our county retirement system, we are in the process. We have an ad hoc committee that I'm on that is working with a consultant to conduct an interview and review process for applicants for the chief executive officer of general manager of the retirement system. And that's going ahead. And so we'll be bringing back at our next board meeting probable applicants and interviews. And then finally, most of the comments on social media and emails that are coming to me, and I'm assuming to the others, to the rest of you, about the coronavirus has to do obviously with safety, but then secondarily, in a close second, would be concerns about the economy. And so I'm hoping that part of our emergency response by the county will include maybe one deputy CEO or maybe two, because we want backup, who would be dedicating at least a little bit of time to continue working with West Business Center and EDFC, because they seem to be our primary sources to refer people to. When people comment to me, I try to refer them to West Business Center because I see them as being the experts on what resources are available to businesses. But I think, this is, as this goes on, we're going to see a lot of businesses as casualties in this. I think we're going to see a lot of retail businesses in particular being unable to pay rent, their personal rent, pay their commercial rent. And so I'm just really concerned about the economy. And I think that needs to be foremost in our emergency planning.
Thank you, Supervisor Jurdy. Supervisor Williams.
Almost all of my meetings have been canceled, justifiably so. We're talking about human lives in this county. It could be hundreds, could be well over 1,000. And so I think postponing anything that can be postponed makes sense. My focus has been on COVID. Extra emphasis has been on compliance on the coast. The sheriff has been an invaluable resource in helping shut down folks who were out of compliance. And initially, we presumed they just simply hadn't read the order or understood it. Most of them, as soon as it was explained, came into compliance. The sheriff has been very active in addressing those that weren't as eager to shut down. I've already voiced it, but I'll voice it again. I have concern that some parts of the county, due to the resource constraints, we can only do so much. And the board micromanaging staff would be a net loss. It's better to trust the people we have appointed to carry out the job, but we have a duty to the public to ensure that we're at least tracking. And when I get messages as early as this morning that the Coast Hospital needs 6 ventilators, 20 beds, 2,000 N95 masks, 10,000 surgical masks, and 2,000 gloves, it's a bit of a conflict with what I hear from staff. We need to survey, we need to inventory. And so I will continue asking for the status updates on, have we completed the survey? Have we placed the order? Because ultimately it's on us. If we have personnel available and they don't have the tools they need and we have deaths, that's on this board. Our job is to, at a minimum, track. That's all I have.
All right. And thank you, Supervisor Williams. Let's see, I attended a first 5 meeting. These are all virtual meetings that have gone on in the last couple of weeks. Certainly there's a lot of transition in that program with the interim executive director, just taking, taking her position in that, and we welcome her, but it's certainly a lot of things to deal with in that position at this point. There was also a Juvenile Justice and Delinquency Prevention Council, and we had a great presentation by Joanne Rosen about the community resiliency model and how that can be used effectively for dealing with mental health or people in crisis situations throughout our county. So whether they're first responders or just people on the street who can have a lay approach to this, is a very effective program. Last week, Supervisor Jurdy and I missed the Workforce Alliance of North Bay meeting because we had the conflict with the emergency meeting we had for the Board of Supervisors on Friday morning. So unfortunately, we missed that. And I appreciate Supervisor McCowan bringing up about the SEIU 2015 letter for the in-home support service workers. And I've been hearing a lot from those people who are very vulnerable and feel like they aren't getting some of the supplies they need in very delicate situations. So I'd like to see that letter, make sure that that letter goes out next week. Okay. So.
Mr. Chair?
Yes. Supervisor.
Yes, thank you, sir. I did skip over one very important item that was on the Golden State Finance Authority agenda. It was an item that was fully discussed and debated, so I'm sure you may hear about it from our colleagues around the state. The item was the consideration of approving a loan to the Golden State Natural Resources, Inc. of up to $10 million. And as previously reported to your board, to our board, that the GSNR, recognizing that its proposed activities would further the public purpose of the GSFA and its member counties, it was created. And it is a nonprofit public benefit corporation and is governed by a board of directors consisting of 5 elected county supervisors who are members of Golden State Finance Authority and RCRC boards. The agenda item was discussed for well over an hour with vigorous debate, and at the conclusion, action was taken to approve with modification to the original recommended motion, and only 2 were opposed. But I wanted to bring that up because you might hear about it, and there will be more discussion about it at the next meeting. So thank you.
Okay, thank you, Supervisor Brown. All right, so with the conclusion of the supervisor reports, we will be going into closed session, and we will start at 12:13. The agenda items are 9A, pursuant to Government Code Section 54956.9D2, conference with legal counsel about anticipated litigation, significant exposure to litigation, 1 case, and 9B, conference with legal counsel, existing litigation, Project Coyote versus the County of Mendocino, and Mendocino County Superior Court case number SCUK-CVG-20-73782.
Hi, Chair Hashtag.
Yes.
May we please have a 5 to 10 minute break?
Yes, we will come back at 12:10 if that works for you.
Great.
Okay.
And Mr. Chair, do we just stay on, like I'm a call-in? Because I don't have reliable broadband. Do we just phone in the number again, or how is this going to take
You're
place?
just, Supervisor Brown, you'll just stay on the line, okay?
Okay.
We're just going to move ourselves to another room for closed session.
Got you.
So to be clear, you want everyone to stay on the line?
Please, yes, please stay. What? Please stay on the line. Thank you.
Okay, and so we will come back in the session at 12:10, and we will report out after our closed session. All right, thank you all, and stay well. on. Let's see. Clerk,
With the exception of Supervisor Jurdy. He's here now.
all right. So I'm going to call the meeting back to order. And at 12:50, let's see, in closed session, we dealt with items 9A and 9B, and direction was given to staff in both cases. And with that, I'm going to adjourn the meeting at 12:50. Okay. All right.